It's Wednesday. That means it's WTF Wednesday, and I have something I want to talk about this morning that affects all of us. And this is an issue with doctors. Now, it's not all doctors, of course it isn't. I have a lot of friends who are doctors, and I have the greatest respect for some of them. Some of the others, not so much. But that's the same with any group of people, okay? So this isn't about doctors. Just because you're a doctor doesn't make you a genius or a king or a queen or an idiot. It doesn't. We're all just people. But the issue that I have at the moment with a lot of doctors, and particularly with a doctor that I saw this morning, is that there tends to be, or one does encounter, a mentality of, I'm a doctor, I know everything, I'll tell you what it is, I'll tell you what to do, I'm not having a discussion with you, you're just the patient, you don't know anything, I will tell you, don't you ask me questions and don't you make suggestions. And that mentality, unfortunately, a lot of us encourage it by being quiet and just listening and just accepting everything a doctor tells us. And it's not always correct. Or sometimes it's partly correct. And sometimes they might very well be missing something. The same as anybody in any job. Okay? That's just a person with a job that they had to study a long time for. So, what is my issue today? Because it's just really illustrative of this problem that we have, and I'm going to talk about what we do about it, but I have some pain around my left hip area at the moment, and I had an accident. I got knocked off my bicycle by a truck probably 2 years ago now, and it's just been difficult ever since. And I went straight for an x-ray, nothing broken, and that's all they look at. They do an x-ray, it's not broken, okay, all the pain will go away and you'll heal. Here's some anti-inflammatories, and so you kind of accept that. And it's never been quite right. I know that I have a problem with my hip flexor tendon, which is sort of down the front of my hip, and a little bit round the side into my gluteal tendon, probably the gluteus medius tendon. So either it was torn or damaged in some way, something's not right. And so I was able to get the doctor about a month ago, convinced the doctor to send me for an ultrasound. And during the ultrasound, the first thing the person with the ultrasound machine said was, you have some arthritis in your hip joint. I said, well, yes, I have a bit of degeneration of cartilage, but everybody does. I mean, that's normal, including people who don't have any pain and discomfort. Cartilage wears down and gets rebuilt on an ongoing basis. We know that. That's normal. You're looking in the wrong place. You need to move this machine around. I want you to look at the front. I want you to look at this tendon. I want you to look at my gluteal tendon. Oh, yes, she says, now we see you've got calcium deposits under the skin, around that area, around your tendon. I thought, aha, there we go. Now we're getting somewhere. Check for any tears or anything damaged. No, but that's definitely scar tissue in those tendons, which influences or impacts on the flexibility and the use of those tendons. And the elasticity is impaired, which makes my gait difficult. Anyway, I get back to the doctor today, because now she sent me for the echogram. I come back today and I sit down and she says, okay, what can I do for you? Excuse me? I'm back because you sent me for the scan. Oh, when was that? Oh boy. All right, about 4 weeks ago, looks up on the computer. Oh yes, here we go. And she finds it. Now she doesn't remember the consultation we had. She doesn't remember the conversation I had about crashing off my bike and about where the pain was. She just goes straight to the echogram. Oh, I see they say here you've got arthritis. I said, yes, I know they said that. They told me that as well. But if you go and look again, you'll also see that I've got these calcium deposits in my tendons. That's where the problem is. So she looks at that. Oh yes, I see. They say you've got these calcium deposits, but you've got arthritis. I said, yes, that's not the issue. I don't have problem inside the joint. That's not where my pain is. That's not where my problem is. My problem is out the front here and around the side in these tendons. So what can we do about that? No, we don't need to do anything about that. There's nothing wrong with them. I said, but I've got these calcium deposits in the fibers, in between the fibers of the tendon. Yes, she says, but that's not where your pain is coming from. I said, well, look, it is. I know where my pain is. I can put my thumb on it and press it and it hurts. That's where the pain is. No. Your problem is arthritis. Oh, for heaven's sake. No, it isn't. It's the tendons. I'm wasting my breath here. Doctors are taught, somebody comes in with a sore hip, send them for a scan. If you see any sign of degeneration of cartilage, stop looking, stop thinking, tell them they've got arthritis and they're going to need a hip replacement. I mean, what? No, just listen to me. I'm telling you where it hurts. Not listening. Then starts telling me the best I can do is take anti-inflammatories. Yes, I know that. I've got them. I've been on them for 2 years, on and off. You must take collagen. I have a collagen supplement. It's got to have magnesium in it. Yes, I've got one that has magnesium. You must take vitamin C. Yes, I know that. And magnesium biglycinate is better than my magnesium citrate. I have magnesium biglycinate in the house. Wouldn't stop talking to listen to anything I had to say. Didn't ask me what I eat, what supplements I have, if I've already taken these supplements. Didn't try to find out what I already know, what I don't know. She has a formula. Hip pain, scan, I see some degeneration of cartilage. I'm going to diagnose arthritis, and then I'm going to rattle off this list of things that I'm told I must tell the patient to do, even if the patient's already doing it. And that is the end of the consultation and the end of the discussion. And I left there thinking, well, what do I do now? It's like unbelievable. I'm on my own. It's the government health service, so you kind of feel like you have less rights because you're not paying. So do I now have to use my own money to go to a private doctor where they will be more inclined to listen to me because I am paying them, and maybe I can get some joy that way. Anyway, I think that's my what the F Wednesday. It really is a what the F Wednesday for me. It's just unbelievable. Everything is by formula. The doctors are taught a whole lot of things, unquestioned, learn it by formula, rattle off this list of prescriptions, move on to the next patient. And I don't know if that's because of the system, or if it's because of the money that's involved coming from the pharmaceutical companies and the medical companies that sponsor the doctors or employ them, whether it's just hit or miss, whether you get a lazy doctor or a doctor that really wants to engage, or whether they're just completely overworked and overrun and all they can do is revert back to the playbook and just throw it out at you and try and get you out the door as soon as possible so that they can get the next person in. I'm not a conspiracy theorist. I don't think for 1 second that there's some kind of giant international conspiracy of doctors trying to somehow make us all sick. I mean, that kind of nonsense, I don't buy into that kind of nonsense. But I certainly understand the power of money, and the pharmaceutical companies and the medical companies and the hospital chains make a lot of money from prescribing drugs and procedures. So maybe a hip replacement is a great money spinner for a hospital. But people are just people, and doctors are just people. And just because you study for 7 years and become a doctor doesn't suddenly mean that you are all-knowing. It means you've learned enough to be able to carry on learning for the rest of your life. That's what it actually means. And you need to be listening to people and consulting with them. So our solution to this, in as much as there is any kind of solution, is to educate ourselves as much as we can to understand our own bodies and understand the science and the biochemistry that underpins our health, so that we can manage our own health as much as possible. And the way to do that is diet and lifestyle. Then when you do have a problem, it's an individual problem and it's not some symptom of a wider problem because you are metabolically sick. Okay, if you end up with metabolic syndrome and you're obese and you're insulin resistant and you have heart disease and you have autoimmune issues, and it's very confusing, and you just get prescribed a whole handful of different drugs, some of which interact with each other and cancel each other out, or worse, cause problems. And you spend more and more and more and more money and you never really get healthy. So just subscribe to this channel, please, and just come with us on this journey and learn as much as you can. I try to do my videos to explain things at least on the easiest to understand way without dumbing them down and being stupid. And it's really not that complicated. Lower your inflammation, keep your weight down, don't eat junk, don't eat sugar. Eat the stuff that's going to give your body the nutrients it needs to keep you as healthy as possible, and you will spend less time arguing with a doctor and feeling ignored and frustrated. And I'm going to have to figure out how I'm going to sort this out. I do have a couple of ideas, but that's not for this video. This video it's Wednesday. So it's Wednesday. And on Wednesday, I want to go WTF about something. Makes me feel better. I hope it makes you feel better. You're not alone. When you have this issue with a doctor or a medical professional, it's not just you. Okay? It's not just you. If you have the luxury of being able to choose your own doctor and have a relationship with your doctor, that's fantastic. But the main thing you need is a relationship with yourself. So you need to educate yourself. Keep up to date with the science, especially in the areas that might affect you personally. So whatever issues you have, read up on it, watch videos, look at the studies if you've got the time to do that, and if you have enough of a science background to be able to read the studies. Otherwise, read other people's analyses of the studies, or watch my videos where I will talk about them and I will explain it to you in an easier to understand way, or even contact me, come through my website, have a consultation. Well, that you can access through my website as well, shapefixer.com. Okay, that's me for this Wednesday. Very self-indulgent. But WTF was the doctor trying to say to me this morning. It was a complete waste of time. Thank you for your time. I hope your time wasn't wasted. And subscribe to our channel, and I'll see you back here next Wednesday. We will be making other videos in the week. So if you do subscribe, you'll get notification every time we publish something new. Thank you again.